I was hoping to get a shot here. Rural areas in Texas, they don't get a lot of vaccines.
54-year-old Jorge Figueroa knew that finding a COVID-19 vaccine was going to be a challenge.
Looking around, I almost went to Midland or Odessa to get a shot. 4 hours drive, over 200 miles. I have a little girl, so we cannot go and spend days there, so you need to go and come back the same day.
Jorge lives in one of the worst so-called pharmacy deserts in the country, an area defined by extremely limited access to pharmacies. With the federal government now calling on pharmacies to help with the COVID-19 vaccine rollout, an ABC News investigation found that millions of Americans like Jorge face tough odds finding a shot because of where they live.
So that's 500 miles just to get the vaccines.
Forcing some to go to extreme lengths to get a vaccine.
About to drive 90 miles one way, and in my hand I have some COVID vaccine that we're shuttling down.
Pharmacy deserts hit communities of color the hardest, like here in Presidio, Texas, a remote, mostly Latino town nestled in the Rio Grande along the U.S.-Mexico border where Jorge lives. When you heard that they were starting to roll out some of the vaccines at pharmacies, what did you think?
They said, well, it's good for people that live in big cities, right? For us, we are so far from everywhere. I mean, it's bad.
The nearest pharmacy 60 miles away in Marfa, the closest one planning to offer the COVID-19 vaccine even farther, a 90-minute drive to Alpine, which is also home to the nearest hospital.
In emergency, I mean, it's hard to drive 90 miles and get to the emergency room, so.
Jorge, an uninsured father of 4 who lost his construction job during the pandemic, is worried about getting COVID because he suffers from high blood pressure. How eager have you been to get the vaccine?
I have family in Mexico, and I lost a few family members. Some of my friends from school in Mexico, some of them, they die. And I say, oh God, you know, I'm the same age. And I will say, okay, where's the vaccine? You know, when it's gonna start? So yeah, if I drive from here to Odessa, it's showing me 3 hours and 38 minutes right now at this time.
So 8 to 10 hours for the whole
Yes.
trip, back and forth.
Yes.
You were willing to drive that far just to get the vaccine?
Yes.
If Jorge lived in one of his neighboring majority white counties, his opportunities may have been different. Data shows they have more pharmacies at their disposal per capita, despite Presidio County having nearly twice the number of COVID-19 deaths of both majority white counties combined.
This is the main drag of Presidio.
Dr. Adrian Billings is one of the few doctors serving Presidio.
There are no corporate pharmacies out here, and when I heard that CVS and Walgreens were going to begin vaccination, the reality, set in very quickly. It shouldn't be that because there are not these organizations out here that our community suffers as a result of that.
Medical resources here so slim that Dr. Billings says it's common for Presidio residents to cross the border into Mexico for health care.
I feel that that's unjust. I feel that our residents here in Presidio, they deserve more.
Nearly all of Presidio's healthcare needs fall upon this lonely place.
How are you?
A federally supported health center called Presidio County Medical Clinic, where Dr. Billings has a weekly shift.
We're doing the best that we can, and this pandemic has certainly put a strain on an already under-resourced, rural, small healthcare system.
Good morning. Are you our patient already?
Linda Molinar runs the clinic, where her small but devoted staff serves thousands of patients.
Working at the Presidio Clinic, it is very overwhelming.
Things got worse when the city's only pharmacy shut down several years ago.
I knew what that meant for our community. It meant people would die because it doesn't matter if I have doctors. There is no pharmacy for them to pick up a medication.
So she took matters into her own hands.
We talked to the pharmacies in Alpine, and they're able to put the medication in a bus and then transport that medication to Presidio.
About twice a week, those vital medications must travel 90 miles on a Greyhound bus through the open desert.
So when a patient comes to our clinic and is needing a medication, they'll have to wait a couple of days.
In the absence of pharmacies, Linda's clinic is also the only COVID-19 vaccine provider in town.
We're not receiving a steady amount of doses from the state.
So Linda's gotten many of her vaccines from distant hospitals.
Yesterday, I got the call from Midland Memorial Hospital that they have transferred 600 vaccines that could be used at her clinic in Presidio.
And she or her staff has to go pick them up.
It's a 250 miles just to drive from Presidio to Midland, and to come back is another 250. So that's 500 miles just to get the vaccines. That would be 8 to 9 hour driving process.
When somebody tells me they have vaccines, I don't even think twice about it. I get in my car and we go pick them up because I worried, what about if somebody else takes them?
We already have it set aside for you. 100. So that's 100 vials, that's 600 doses.
So here's our vaccines.
We're so excited. I know our community's excited about them.
500 miles and a day later,
we have arrived to Presidio with the vaccines for today.
the real work can finally begin.
Good morning, everybody.
Linda and her team are setting about vaccinating as many people as they can.
So the vaccine you'll be receiving today is the Pfizer vaccine. Take off your jacket so I can see your arm. Here goes quick stick, 1, 2, 3 stick. And we're done. Quick poke, 1, 2, 3 shot. And we are done.
Thank you very much.
How many vaccines do we still have?
Around 200.
No. Yeah. Okay, no. Okay, perfect. How's everybody doing? We're excited.
But it isn't long before Linda and her staff are faced with difficult decisions.
Come in, let me help you. No, that's okay. That's okay. He's here because he needs results of his lab for another individual that needs to have surgery on Friday. So I'm going to see if I can find a staff that's not doing something to fax them for me.
We do not have the workforce to maintain our medical clinic and our dental clinic at the same time that we're doing COVID vaccination. That is not without consequence to our patients.
Those are important things and they need to be taken care of. And normally we have a staff that does that, but today we can't, so. Right now, why I'm closed, because I'm doing COVID vaccines, who's taking care of the sick people? Nobody is. What is more important? Do I do vaccines? Do I see these people that are needing their insulin? I had people right now that's supposed to give allergy shots every other day, and we're the only clinic that does this. Where are they supposed to go?
Deciding between providing vital care or offering the vaccine isn't the only dilemma for Linda on days like these. Her limited supply means she must also choose who amongst her community gets a shot in the first place.
I am the CEO of a clinic, but who am I to tell people I don't have vaccines? And they qualify. They have cancer, they're diabetic. Why? Because there's not a system where we can get vaccines every week, every month. We don't know.
Nationally, pharmacy deserts hit rural areas the hardest, but they aren't the only vulnerable communities. On the south side of Chicago, in the Auburn-Gresham neighborhood, 80-year-old Juanita Love and good friend 78-year-old Betty Swanson are excited to get their COVID vaccines. They used to be able to walk to this CVS 3 blocks away, but it shut down last year, the company citing low financial performance.
We have nowhere close to go, you know, and the ones that don't have cars or be able to go, they're left really in the desert because they can't get the goods that they need.
In Chicago, nearly 1 million people live in a pharmacy desert. Most of these exist in black and brown communities.
So many people just take for granted there's a pharmacy every other block in their communities. Do you think people have any idea how difficult it is?
No one knows how it is but the ones that it hit, and it hits with us.
Here, the problem isn't so much distance, but density. In Juanita and Betty's neighborhood, for example, there's one pharmacy for every 13,000 residents. Compare that to Wicker Park, a mostly white community, which has a pharmacy for every 4,000 residents. So to get their COVID shots...
You excited about it yet? I'm excited. Glad to get it over. Yes.
The two ladies drove to a Walgreens on the edge of their neighborhood.
Are you worried that some of the other seniors in your neighborhood might not be able to get the vaccine because they can't get to the pharmacy?
I am. We got a veterans group. Some of them in wheelchairs, some of them on crutches that could walk to CVS at one time. But now they would have to get on a bus or get a cab or whatever. There's no easy way.
When we think about, structural inequity, the pharmacies follow the rest of the patterns that we've seen across Chicago.
To address Chicago's pharmacy deserts,
Right there behind 6 feet.
the mayor's office teamed up with local healthcare providers.
We are already hitting the consent line.
Like Dr. Ali Khan and his team of Oak Street Health to bring vaccines directly into some of these communities.
The city was able to pick the top 15 communities and said, we're going to do something bold here. We're going to guarantee doses to an entire community, up to a percentage of that community.
Each weekend, Dr. Khan and his team work out of this high school in the predominantly Latino community of Belmont-Cragen on Chicago's northwest side.
Spread the word. Tell all your friends. We want everyone vaccinated.
One of the biggest things that we've heard has been, you put this 3 blocks from me. This is a game changer.
Having an event like this gives them access in a way that they wouldn't otherwise have. Done. Congratulations. Thank you. You're welcome.
Back in Texas,
I was lucky to get the shot. I feel lucky. I feel really lucky.
after weeks of searching, to Jorge's surprise, it was Linda's clinic that was able to vaccinate him.
How did it feel that you got the vaccine?
I feel like a relief, but it gives you more peace of mind, I guess.
Jorge can now rest easy, but Linda worries that as the vaccine rollout expands, there's no way her little clinic will be able to keep up.
Now, somebody needs to come and help Presidio and vaccinate Presidio. Otherwise, it is going to overwhelm the system here. They need to send their either state or National Guard down here. They can do 1,000 a day, but for us to get 100 vaccines, and if that's if we're lucky, it's too much.
Our thanks to Deborah. And for more on our investigation, please go to abcnews.com, where you can find an interactive map on pharmacy deserts across the country.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.